Hey everyone, welcome back for another deep dive.
Ready to get our learn on.
Always. So today we're going to do things a little differently, a little alphabetically.
Oh, intrigued.
Yeah. So I was looking at Dr. Khaled Hasan. He's he's got that podcast where he breaks down all these different drugs. Right?
Oh yeah, I've heard some of his stuff really makes pharmacology. What's the word? Accessible.
Right. And I thought, you know what? Let's pick a letter, any letter, and just dive deep into all the meds that start with it. You game.
Absolutely. Adds a bit of fun to the mix, doesn't it?
Totally. And I was thinking, let's go with D.
D. Okay, I like it. Plenty of options there, I bet.
Oh, tons. And some of them, you wouldn't believe the connections. Like we're talking an acne treatment that also helps with certain STIs.
That's interesting. Shows how sometimes one drug can have multiple uses depending on, well, the mechanism of action, right?
Exactly. Okay, so first up on our D list, we've got dabigatran. You might know it as Pradaxa.
Yes, dabigatran. So this one, it's an anticoagulant. And it works by basically directly blocking a specific clotting factor in the blood.
So it's preventing clots.
Precisely,
Right.
which is super important, especially for folks with, say, atrial fibrillation, irregular heartbeat, helps prevent strokes, embolisms, that kind of thing.
So how's it different from like warfarin, which I know is also a blood thinner?
Good question. So warfarin, it's been around longer, but it needs close monitoring, dietary restrictions. Dabigatran, it's newer, a bit more flexible in that sense.
Interesting. Okay, next on the list, we've got dalteparin, or fragment. Another one for the blood, huh?
You got it. Dalteparin, it's also an anticoagulant, but it's got a different way of working. It actually boosts a natural inhibitor of clotting factors.
So it's kind of like enhancing the body's own system.
Exactly. Really useful, especially in hospital settings, patients after surgery or those who are immobile, helps prevent those pesky clots.
Makes sense. Okay, shifting gears a bit, let's talk bones. Denosumab is next, and it's marketed as both Prolia and Xgeva.
Denosumab. This one's fascinating. Imagine it like a very specific construction crew in your bones. It targets and halts the activity of those cells that break down bone tissue.
So that's how it helps with osteoporosis.
Yep. And it can also be used when cancer has spread to the bones, to help prevent further weakening.
Wow, really protecting those bones.
Okay.
This next one, I bet most people have seen it on their medicine shelves at some point. Dextromethorphan.
Yes, the famous DM and all those cough suppressants. Now, this one's different from expectorants, those that help you cough stuff up.
Right. Yeah.
Dextromethorphan, it works directly on the brain. Basically, it suppresses the cough reflex itself.
So it's not about loosening phlegm, it's about stopping the urge to cough altogether.
Exactly, like hitting the mute button on that cough.
Huh, interesting. Okay, moving on to a drug with a bit of reputation. Diazepam, better known as Valium.
Valium, yes. It's a benzodiazepine, which means it calms the central nervous system. Think of it like a wave of calm washing over your brain.
Calming the brain, so that's how it helps with anxiety.
Exactly. Also good for relaxing muscles, even controlling seizures in some cases. Been used for decades, actually, for anxiety and insomnia.
So more to it than just the pop culture image.
Definitely. Okay, so next up we have dicyclomine. You might see it as bentyl or D-bent.
Okay, dicyclomine. What's its deal?
This one, it's for those of us who suffer from stomach cramps. It's an antispasmodic, so it specifically targets the smooth muscle in your digestive system.
So helpful for things like IBS, where those muscle spasms are a real problem.
You got it. Really helps soothe things down, makes those uncomfortable symptoms more manageable.
Okay, makes sense. Next on the list, Dunpezil. The brand name is Aricept.
Now, Dunpezil, it's like a guardian for those important messengers in your brain, acetylcholine. It's vital for memory, for cognition.
The list, Dunpezil. The brand name is Aricept.
Now, Dunpezil, it's like a guardian for those important messengers in your brain, acetylcholine. It's vital for memory, for cognitive function. And Dunpezil protects it from breaking down.
So that's why it's used for Alzheimer's.
Exactly. And, there's some interesting research going on looking at its potential for other brain disorders, too.
Really? Like what?
Well, they're exploring it for things like Parkinson's, even traumatic brain injury. Still early stages, but promising.
Wow, that's fascinating. Okay, on to doxylamine. It's also known as Cardura.
Doxylamine, it's what we call an alpha-1 blocker. It helps relax certain muscles and keeps those tiny blood vessels nice and open.
So that's why it's used for high blood pressure.
That's one use, yes. But it's also helpful for men dealing with with an enlarged prostate, BPH. It relaxes muscles in the prostate and bladder, which helps improve urine flow.
One drug, two different applications. It's amazing. Okay, next up, doxycycline.
Doxycycline, it's a tetracycline antibiotic. Basically, it stops bacteria from growing. Think of it as a bouncer for your cells, keeping those harmful bacteria out.
And that's why it can treat so many different things.
Exactly. It's a broad-spectrum antibiotic. So acne, certain STIs, even tick-borne illnesses like Lyme disease, doxycycline's got it covered.
It's like a multi-tool of the antibiotic world. Right. Okay, on to doxylamine.
No, doxylamine, this one's an antihistamine. You'll often find it in those nighttime cold and flu remedies.
Oh, what?
It blocks the effects of histamine, which is, it's the culprit behind all those sneezing, runny nose, itchy eyes, you know the drill.
Right, and the nighttime part, is that because it makes you drowsy?
Exactly. Makes you sleepy. So it's often paired with a decongestant for a combo effect.
Makes sense. Okay, next we've got a combination medication, drospirenone and ethanol estradiol. The brand name is Yaz.
Yes, Yaz. A popular choice for birth control. So this combo, it contains a synthetic form of progesterone, that's the drospirenone, and a form of estrogen, the ethanol estradiol. Together, they work to prevent pregnancy by stopping ovulation.
It's amazing how far we've come in terms of hormonal manipulation.
Truly, a real testament to the advancements in women's health.
Okay, last but not least, we have dutasteride, or Avodart.
Dutasteride, think of it as a shrink ray for the prostate. It blocks the conversion of testosterone into DHT, which is, it's a hormone that can stimulate prostate growth.
So another option for BPH, helping with those urinary symptoms.
Exactly. By reducing the prostate size, it helps relieve those issues.
Wow, what a journey through the world of DA drugs. It's amazing how many different ways they work and for such a variety of conditions.
Absolutely. It really highlights the complexity of human biology and the incredible ingenuity we've applied to develop these targeted treatments.
Thanks for walking us through it all. And for our listeners out there, I'll leave you with this. We saw how some of these drugs have multiple uses. Do you think there are even more out there, waiting to be discovered? Keep that curiosity alive, and we'll catch you on the next Deep Dive.